What issue tops every list of national worries? Healthcare. Everyone, employers, employees, and individuals, worries about how to get in pay for medical care. Consumer-Directed Healthcare, or CDH, is the latest response to rising healthcare costs. CDH teaches and empowers consumers to take financial control of their healthcare spending. Health savings accounts, or HSAs, are the centerpiece of this approach. I want to take a few minutes to introduce you to health equity and to the concept of consumer-directed healthcare, and how health savings accounts can be a great addition to your benefits package. Are you looking for a way to save on healthcare costs? Who isn't? Would you like an opportunity to invest and save more money for retirement? Of course you would. What if you could do both? And do both with a triple tax-advantaged account that saves you even more. We're going to show you how. At Health Equity, our mission is to help you manage the financial side of your healthcare and enable you to be a better, more engaged consumer of healthcare. We do this through our innovative consumer-directed healthcare offerings that combine a high-deductible, low-premium health plan with a health savings account. The high-deductible health plan helps you save money on your insurance premiums. The Health Savings Account, or HSA, offers a tax-free way to pay for qualified medical expenses and save for future healthcare costs. Over the next few minutes, I'm going to tell you how it works and why you should consider a consumer-directed healthcare plan today. So you're wondering how consumer-directed healthcare works. As I said, CDH combines a high-deductible health plan with an HSA. The deductible is the fixed amount you pay before your insurance starts kicking in. The minimum deductible for an HSA qualified plan is listed on the screen. You may be wondering what exactly a health savings account, or HSA, is. The easiest way to think about it is as a medical 401k. It's a triple tax-advantaged spending and savings account that allows consumers to put aside a set amount of pre-tax dollars every year that can be used to pay for qualified medical expenses now and to save for future healthcare costs in retirement. The money goes in tax-free. You can invest and grow the money tax-free, and as long as you spend it on qualified medical expenses, you can spend it tax-free. As I mentioned, you can use the funds in your health savings account to pay for qualified medical expenses. These qualified medical expenses include what you would ordinarily think of when you think of medical care: doctor and hospital visits, prescriptions, medical devices, and care. You can find a list of qualified and non-qualified expenses at the IRS website. They are printed in Publication 502. When you visit the pharmacy or local store to buy prescription medications, you can use your Health Equity debit card to pay for them. Or go online and use our Easy Pay Choice payment system to pay providers directly from the account. With a traditional health plan, you pay premiums that provide benefits for a certain period of time. When that time ends, your benefits and your premiums are gone. It's kind of like renting a house. When you put money in a health savings account, you own it. You decide when to use it, how to use it, or even if to use it to pay for qualified medical expenses. You own the account regardless of whether you change jobs or retire. And the money earns interest, tax-free over time, increasing the value of the account. It's a great way to save for medical expenses after you retire. Consumer-directed healthcare plans typically cover all the same health costs a typical plan would, with a few additional benefits. A typical CDH plan will cover many preventative services at 100%, regardless of whether you've met your deductible, and with no copay. Each CDH plan is different, so be sure to read your summary of benefits to determine the specifics of what's covered under your plan. One of the ways in which Health Equity is different is our member portal. When you visit myhealthequity.com, you will discover that we have worked with your health plan to integrate your healthcare claims information into an easy-to-use and understand format, so that it will be clear to you what you need to pay and when. You only have to log on to the website to view and pay your claims online, invest unused funds online, and look for cost-saving alternatives when purchasing health services and medications. So we've seen how you can use your HSA. Now let's talk about who can contribute to your account. Well, you can contribute. Your employer may choose to contribute as well. In fact, Health Equity encourages employers to contribute, making an investment in the health of their employees. Your spouse and other family members may also be able to contribute. There is no minimum contribution, but there is a limit to how much you can put into your HSA each year. The limits listed on the screen are set by the IRS and may change annually. Account holders who are over the age of 55 may add a catch-up contribution of $1,000 annually. The simplest way to put funds in your HSA is through regular pre-tax payroll deductions at work, if your employer offers this option. But there are other options too. You can contribute directly to your HSA by check or electronic funds transfer, and any funds that you contribute are tax deductible. Since there are tax advantages to owning and using an HSA, you will need to report how you used your HSA dollars when you file your tax return. Health Equity makes this easy because detailed reports are available at your personal website that show how much money was contributed to your account and how you used those funds. All the information you need at tax time is available to you right from the website, but remember to save your receipts too. These are proof that you used the funds only for qualified medical expenses. In addition to this introduction to CDH and HSAs, we have created a number of helpful tutorials explaining how to use the Health Equity member portal. We cover items like viewing and paying claims online, investment options, and ways to save on healthcare. All of this is in addition to the best member services team in the industry, waiting to help you understand and manage the financial side of healthcare 24 hours a day, 7 days a week. If you're concerned about saving money, taking charge of your healthcare spending, and benefiting from your investment in your healthcare future, you'll see that Health Equity is a great solution. Why not get started today? Pick up some information and talk to your HR representative on how you can get started with a consumer-directed healthcare plan and an HSA with Health Equity today.